I don't think we've made a particularly aggressive effort to deal with addiction. There are excellent treatments, particularly for opioid addiction, which are not widespread. It has taken 25 or 30 years of effort to get insurance companies to cover treatment for addiction the same way that they cover treatment for other diseases. This is a disease which is stigmatized. This is a disease which drives the people who have it and the people who could do something about it into hiding, it seems.
The truth is, treatment is not as good as it needs to be. We need to make more advances, but because addiction is not only well thought of as a chronic disease, but also often involves, almost by definition, breaking the law, and is associated with drug distribution, people, policymakers look at treatment and say it's not 100% magically effective and therefore it's failed. Well, you know, people with diabetes take insulin, they're not cured, they're just managed, they have lots of side effects. We consider it a success.
I think the programs are effective. I think that the problem is a very large one, and I think that it is easy to generalize and say, well, you know, it isn't working because people are still dying. I think this is a complicated problem. There's an availability of this substance on the front end, and it's going to require not just the courts, but it's going to require the medical community, parents, family members to come forward if they feel that someone is going down the road of addiction. It's going to require people to be responsible and not leave, you know, 3 scripts of Percocets in the medicine cabinet, because medicine cabinets are places where kids go. And I think, just like so many things over the many years that the courts have grappled with in substance, we had the Safe Roads Act of 1988. I can tell you that when I started as a lawyer in 1978, and I was prosecuting in Plymouth County in the late 70s, early 80s, as an assistant district attorney, I can tell you we dealt with operating under the influence differently than we do today. And and I think if you go back to the 60s, we dealt with smoking differently then than we do now. So I think these social problems that exist over time, you know, it takes a long time to turn it around. So I think that there's hope. I think that there's room for optimism. I think people are much more informed than they used to be. I think in the schools as well. And but it's why that there's more problems with deaths. I think that as long as we have opiates and substances that can cause the heart to stop, and that includes alcohol, you know, and we're going to have that forever. We're going to see people die from those substances.